Welcome back to Stay Current Podcast. We have another great episode ahead for you. I'm Ellen Encisco.
I'm Tombash.
And I'm Cecilia, Gigena.
And we're research fellows at Cincinnati Children's Hospital Medical Center. As we've talked about before in our work with Cincinnati Children's Hospital, we like to keep you all up to date with some of the latest articles, some of the latest updates. And in this podcast, what are we doing, Em?
We review important articles from the Journal of Pediatric Surgery, as chosen by the JPS editors.
Exactly. This time we're reviewing 3 articles from the last quarter of 2022, from October, November, and December of 2022.
If you're in the Stay Current app, you can see the links below and read the articles for yourself.
Awesome. So we have 3 articles today, like I said. One is about biliary atresia, one is about the POEM procedure for pediatric achalasia, and one is about umbilical hernias in gastroschisis patients. So let's get started with the first one. Cecilia, you're up.
Great. So first we have primary versus salvage liver transplantation for biliary atresia, a retrospective study. And this is a retrospective study from Children's Hospital in Colorado. And their aim was to compare outcomes of pediatric candidates with biliary atresia listed for primary versus salvage liver transplantation. And for this, we talked to one of the authors, Dr. Dor Yoeli.
I am a general surgery resident at the University of Colorado.
And also the editor that chose this article.
I'm Mikko Pakarinen, and I'm a professor of pediatric surgery from Helsinki, Finland.
And okay, first, Ellen, do you want to explain the audience what a primary liver transplant means?
Yeah, so primary liver transplant means that they had a liver transplant as their initial surgery rather than a Kasai procedure initially.
Okay, and salvage transplantation means the one that comes after a Kasai.
And then we further subclassified patients who underwent a Kasai as early failure if they required transplant within the first year of life, and then as late failure if they underwent transplant or were listed for transplant after the first year of life, which is an important distinction.
So what they found is that they have 3,438 patients with biliary atresia that were listed for transplant. Of them, 15% got a primary transplantation.
68% actually had a salvage transplant with early Kasai failure, and then 17% had late failure, so were older than 1 year of age.
And again, that was Dr. Dor Yoeli, the first author of this paper. And what they found is that the ones that got a late salvage transplantations arrived better for the transplant. They have like lower bilirubin rates and less Milpelt scores, and so they were like less ill.
So the interesting and notable is that the waiting list survival was significantly higher in those patients who underwent late salvage liver transplantation, whereas the overall survival was similar in all 3 groups, but the graft survival was superior in those with late salvage transplantation.
And that was Dr. Mikko Pakarinen. He was the editor who helped us choose this particular article. So what do these findings mean? What do they tell us?
The conclusion is that they still recommend doing Kasai prior to liver transplantation in patients with biliary atresia.
Got it. This is huge. This is a great paper. So the only question I have is, what makes a child get an early or a late salvage?
And that was Dr. Todd Ponsky.
Right now, we don't have great tools for distinguishing who's going to have early failure and who has late failure. And we'd argue that undergoing Kasai, our data shows, doesn't burn any bridges. It wasn't associated with worse waiting list survival or worse post-transplant survival. So
the key point here is that the primary liver transplants did not do any better than the salvage patients. So there's really no reason to not at least first try a Kasai.
All right, Em, you're next and this is our article from November 2022.
Our next article is Oral Endoscopic Myotomy, or POEM, for pediatric achalasia, institutional experience and outcomes, And this article is from Children's National Hospital, by Dr. Petrosyan et al.
My name is Mikael Petrosyan. I'm one of the attending surgeons at Children's National Hospital. I am also a program director for our fellowship training. I'm also vice chief of general surgery, pediatric surgery, so to speak, at Children's National Hospital.
And this is a retrospective review of all patients who underwent repair for pediatric achalasia from July 2015 to September 2021. In this period, they had 43 patients, and these patients have gone through 46 different procedures.
Wait, why are there more surgeries than there are patients?
Yeah, that's good. That's a good question, because some of the patients had to have reoperations after either myotomy or POEMs to better their prognosis.
And what they find?
Out of this 46 surgeries, 37 of them was POEMs and 33 of them was primary POEMs. And out of 9 laparoscopic hilar myotomies, 4 of them was the primary surgeries. And they saw that intraoperative complications is more than the myotomy surgeries, but the complication rate decreased over the time when they improved their POEM technique.
And even though they have complications, as Em mentioned, they didn't need additional operations for them.
So the big thing I've seen is after either a POP, which is the gastric POEM for gastroparesis, or a esophageal POEM, both of them, you get sometimes air, extraluminal air after the procedure, either peritoneal air or pleural air. And it's, when I first saw that, it freaked me out. But it seems like it's inert, like it's not a problem, which is what they showed here.
And that was Dr. Toponsky.
Dr. Petrosyan told us about some of the most important modifications they made to the procedure over the years that improved some of their complication rates.
We used to put oral intubation, but now we switched to nasal intubation. That allows us to access the mouth easily on a child. We stopped using the oxygen for insufflation. We now use CO2 for insufflation. We now pre-op patients much earlier because some kids that came to us with overnight NPO had food impacted in the esophagus. And we switched to machines, which is a little bit more detailed, granular. We use Irby machine, which is basically, it injects the fluid and it also cuts. It's a challenging procedure. It requires a significant number of times to be able to do the procedure, to be able to feel comfortable.
As Dr. Petrosyan told, this is a challenging procedure. So for that, he's developing a training course.
So there's now 2 of us are doing this procedure. And I've decided that I'm going to create a course that's going to be sort of an online, sort of showing how to do the procedure. And we're in the middle of developing that course. So yes, it's in works. It's hopefully going to be up and running next year.
What's interesting and great about this paper, I don't think POEMs are commonly done in pediatric patients yet. And it sounds like Children's National is one of the first hospitals doing them frequently. And so this is a very informative review from, one of the hospitals that has the most experience with this. Last article. This one is from December. Dr. Whitholcomb helped us choose this article. And it's called Evaluating the Risk of Peri-Umbilical Hernia After Sutured or Sutureless Gastroschisis Closure. This is a study from the Midwest Pediatric Surgery Consortium. We've discussed some of their papers before. It's a consortium of 11 hospitals in the Midwest. And this was a long-term follow-up of patients they'd studied with gastroschisis, looking at the different types and timing of closure and their outcomes.
Yeah, so I think some of the most important things to think about, it's a cohort of about almost 400 patients, and we had follow-up on a good number of them, well over 300.
That was Dr. Jason Fraser. He was the lead author on the paper and is a pediatric surgeon at Children's Mercy, Kansas City. and the program director for the Pediatric Surgery Fellowship there.
And the treatment of gastroschisis has really changed. And I bet you if we did the same cohort on the now versus when this was from 2013 to 2016, management would probably change. But still people use a lot of silos. And and that was really one of the things we wanted to see is, did silo use change the rate of hernia?
So they broke it down into multiple different groups or comparisons. So first, they divide the patients into uncomplicated versus complex gastroschisis.
When we consider them complicated, is they required a bowel resection?
Complex gastroschisis included patients with intestinal atresia, perforation, necrotic segments, or volvulus.
Oh, I see, yeah.
Then within those groups, you can break it apart into primary versus silo-assisted closure. Within those groups, you can break it up into sutured versus sutureless closure.
And what did they find?
The main findings here are that sutureless closure was associated with higher rates of peri-umbilical hernia and higher rates of peri-umbilical hernia in patients with uncomplicated gastroschisis who underwent primary closure. And although these patients had higher rates of hernia, they did not require more operations to fix the hernias.
Especially in the United States and in our consortium population, silo-assisted closure is the most common thing that people do. And so, we found that there was a little bit lower rate of peri-umbilical hernia in those patients, most likely probably because of the slower reduction of the abdominal contents and decreased abdominal pressure that's associated with the silo use. Having said that, probably clinically that might not be truly important because the long-term effects of this is probably most of these patients do well without ever having to have these repaired, or at least having to have them repaired within the neonatal period.
I think that's super interesting. Like, although you have more umbilical hernias, they close as any umbilical hernia that usually close by itself. So that's cool.
Okay, so that's the big takeaway. The big takeaway is the rate of umbilical hernia repair is not higher with sutureless closure.
Great. That was a set of 3 great articles. To summarize, first we heard about biliary atresia, looking at comparing primary transplantation to patients undergoing salvage, either early or late transplantation, saying that it's still worthwhile to do a Kasai first, according to their study. Then we looked at the POEM procedure for pediatric achalasia, looked at a review of the patients done at one of the larger centers doing this procedure for children, finding encouraging outcomes. And finally, looking at long-term outcomes for patients with umbilical hernias after gastroschisis closure, and finding that even though there might be a higher rate of umbilical hernia in some of these groups, they typically still spontaneously close and don't need more operations.
Great, awesome 3 articles. I think they're super interesting for everyday surgeon.
I believe these articles are helpful for clinicians to just review their practice and maybe try new things if there's something better out there for their patients.
Awesome. Well, as always, let us know what you think.
Subscribe to our YouTube channel, like this video, leave a comment if you like or don't like anything about this podcast. Don't forget to follow us on social media and read the articles alongside with us.
And download the Stay Current app.
Yes, download the Stay Current in Pediatric Surgery app. We've been doing this particular journal review podcast for the last year and a half. If you want to hear about the past articles we've reviewed, take a look in the app. I'm Ellen Encisco.
And I'm Tombash.
And I'm Cecilia Gigena.
And this is the Stay Current podcast.